Hormone replacement therapy, or HRT, is a topic surrounded by questions, strong opinions, and often confusion. If you're navigating menopause, chances are you've asked yourself, is HRT the right choice for me? Welcome back to Menopause Wellness Journey. Today, we're diving deep into everything you need to know about HRT. The benefits, the risks, different treatment options, and the myths you really need to stop believing, so you can make confident, informed decisions for your body and your future. Let's start with the basics. Hormone replacement therapy is used to relieve symptoms of menopause by replacing declining levels of hormones, primarily estrogen and sometimes progesterone. The main goal of HRT is to ease moderate to severe symptoms that can significantly impact your quality of life. Hot flashes, night sweats, vaginal dryness, and the prevention of bone loss and osteoporosis. It's not a one-size-fits-all solution, and it should always be discussed with a healthcare provider tailored to your symptoms, health history, and personal preferences. When prescribed appropriately, HRT can offer powerful relief. Let's look at some of the main benefits. 1. Relief from vasomotor symptoms. Hot flashes and night sweats can make life miserable. HRT is highly effective in reducing both, improving sleep quality and daily comfort. 2. Improved vaginal health. Estrogen therapy can help reverse vaginal dryness, itching, and painful intercourse by restoring moisture and elasticity. 3. Bone protection. Estrogen plays a vital role in bone density. Starting HRT around menopause can lower your risk of osteoporosis and fractures. 4. Better mood and sleep. Some women report improved mood stability and deeper sleep, as HRT may help regulate brain chemicals impacted by hormone changes. 5. Possible heart health benefits. When started early, before age 60 or within 10 years of menopause, HRT might offer some cardiovascular protection, though this depends on individual risk factors. Like any medical treatment, HRT comes with potential risks. These depend on factors like the type of HRT, your age, dosage, length of use, and personal family medical history. Here are some key risks to consider. 1. Blood clots, VTE. Oral estrogen has a small increased risk of causing clots in the legs or lungs. Transdermal, patch, gel, spray estrogen may carry a lower risk. 2. Stroke. Slight increase in stroke risk with oral estrogen, especially for women over 60. 3. Breast cancer combined HRT, estrogen plus progestin, is linked to a small increase in breast cancer risk with long-term use. Estrogen-only HRT used by women without a uterus may have less or no increased risk and could even be protective in some cases. 4. Endometrial cancer. Taking estrogen without progesterone if you still have a uterus increases your risk. That's why progesterone is added to protect the uterine lining. 5. Other side effects. You may experience bloating, breast tenderness, nausea, or headaches, particularly when starting. These symptoms often resolve over time or with dose adjustments. The bottom line, for many women under 60 or within 10 years of menopause onset, the benefits outweigh the risks when treatment is monitored and individualized. HRT isn't just one treatment. There are different types, hormones, and delivery methods. Systemic HRT, pills, patches, gels, or sprays that affect the entire body. Local HRT, creams, tablets, or rings that treat vaginal symptoms with minimal absorption. Hormone types include estrogen only for women without a uterus, combined estrogen plus progestin for women with a uterus. Bioidentical hormones, which should be discussed with your doctor. Not all are FDA regulated. Myth busting. Myth number 1, HRT is dangerous for everyone. Fact, risk is highly individual. For many, HRT is safe and beneficial when started early. Myth number 2, you'll be on HRT forever. Fact, most women use HRT for a few years, then taper off with medical guidance. Myth number 3, bioidenticals are always safer. Fact, bioidentical doesn't always mean better. Custom compounded hormones are often less studied than FDA-approved options. The decision to use HRT should be made with a doctor who truly understands menopause care. Here are questions to bring to your appointment. Am I a good candidate for HRT based on my symptoms and health history? What are the specific benefits and risks for me? What type, dose, and method do you recommend, and why? How long would I need to be on it? Are there non-hormonal alternatives for my symptoms? How will we monitor for effectiveness and side effects? Hormone replacement therapy can be a powerful option for managing menopause symptoms and improving well-being. When used by the right person, at the right time, in the right way. The most important thing? Get personalized advice and make a choice that aligns with your unique needs and values. What are your thoughts or questions about HRT? Have you tried it? Let's support each other in the comments. If this video helped clarify HRT, give it a thumbs up, subscribe to Menopause Wellness Journey for more empowering content, and hit that notification bell so you never miss a future episode. In our next video, we'll explore menopause and weight gain, the science-based solution no one talks about. Thank you for watching. Let's build a supportive community for women.